Welcome back, dear listeners. We hope you've had a great week and are ready to dive back into our thought-provoking conversation. We can't wait to continue from where we left off. Remember, if you have any questions or want to share your insights, feel free to reach out to us on the social media platforms with the hashtag Pause and Effect Podcast. We love hearing from our listeners, and your feedback makes our conversations even more enriching. So, without further ado, let's jump into part 2 of this conversation. So, Daniel, talk some basic, before they get to you, talk some basic training tools that you find really make a difference in terms of trying to manage some of those responses. You know, I want to give an example. I have a bull terrier. She's quite a character, and she's been quite a challenge, which is why you and I have engaged in a lot of conversation about behaviour. And yes, she was a rescue. I took her on at a very young age and nursed her back to health. But as typical bull terriers, they are highly strung. And I had quite a few behavioural issues with her, not fear-related necessarily, possibly. But one of the best tips and tricks you taught me in those early stages was to get her to sit before I touched her when I got home, so that she would calm down. And it's saw it this morning. I arrived and went to greet her, and she sits now because she knows that at that moment she's going to get affection. I think has been such a incredible tool that you gave me, that's made such a huge impact on how I manage her behaviorally. What are some of the things that you, in terms of basic training aids, that you can get people to practice at home, other than maybe lying on their bed and rewarding them there? Is it the sit? Is it the down? Is it the stay? Are there any things that you would advise people, or is it just general training?
Well, I think it's a good question, because I think a lot of times people come to me and they go, my dog's out of control. It pulls on the lead. It doesn't matter what lead. It's a harness, it's a collar, it's a half check, it's a slip lead. It doesn't matter what they're using. The dog just pulls. And then the dog jumps. A lot of the time it jumps up on you. And to the point where people I just can't be bothered. So they lock the dog in the back garden and they're actually too scared to walk out, especially they've got little kids as well.
This is a vicious cycle of not engaging.
Exactly, it's not engaging. But the dog just is really, really excited to actually see you. So a lot of the exercises that what I'm trying to put in place at the moment is, first of all, respect her around a lead. Okay? And a lot of people think that they have to engage with the dog whilst on the lead. And I'm talking engaging. Fighting the dog all the time. And now, if you just hold the lead tightly, and I'm saying tightly to your body, okay? So there's no actual movement from your point of view. The dog then calms down. The moment the dog calms down, drop it a treat. I'm saying drop. I'm not saying give. Now, there is a difference, in my opinion. Because the moment you then back into engaging the dog, and the dog then starts looking at you because we're standing up, the dog goes, oh, I can jump up again. But if you drop in the treat, the head goes down and picks up the treat off the ground. So
let me get this right. You're not handing them the treat.
You're not handing the treat.
The treat is falling onto the floor.
Correct. And the dog's head is down to the ground. So in other words, we're in a bit of a submissive kind of posture. Okay? And the dog starts calming down. Once you see that dog's calming down, you watch the tail. Often the dog's there, yes, especially like your little spaniels and that kind of stuff, like so excited, okay? And bull terriers. And the tail's going crazy, but it's not, it reduces the tension on the lead. We can reward for that. Okay? Then the dog maybe steps back. We then shorten the lead slightly. Then it releases that again. We reward for that. Tail stops wagging, reward for that. Now you can hear the breathing slowly down. Now you can engage and touch the dog. But when we're touching very, very gently. We're not actually stimulating the dog back up to, oh my God, give me more. So it's very, very gentle. So we can reduce the treats, but we then start creating contact, which actually the dog is wanting. But now the dog is learning that actually when it is relaxed, there's contact. We often do the sit command just simply because it is the most common word that people say to the dog.
Even when they're standing.
Precisely. And but what we often do, and we often make this mistake, is that we over-vocalize. So we can come along and, Fluffy comes running up to us and tries to jump on us. And the moment we see the dog, we go, sit, 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 sit. The dog doesn't understand the word. It's the same as if we say no. Does the dog understand the consequence of the no? No. Does the dog understand the word sit? No. We wait for it. If the dog offers, we reward. The dog goes, I like this. I can just park off. I still get food or attention or whatever. So the dog then starts offering you the correct behavior, and we're rewarding for the correct behavior.
Very interesting.
But it's just, what I find is that we, the owner, the handler, needs to just calm down and watch the dog and reward for what we want.
So going from calming down, let's talk about exercise, because in my opinion, that's one of the things I've noticed since being back in South Africa, is that dogs are not generally walked. I think, I have a lot of clients who say, my garden's really big, and they run around and they chase the monkeys, and that's their exercise. I know there are a lot of people who prioritize dog walking, and I think it's great. Perhaps some people don't because of their circumstances or their working hours or because they have a very difficult dog. But how important is regular exercise and mental stimulation for our pets in terms of anxiety and stress and fear?
Sure. I think you just said something which is really critical, is that mental exercise. It's that, we want to go along, and we often in basic training, basic obedience, we class it as a heel command. So the dog walks on the lead right next to us. And people go, so I have to walk the dog permanently there. No. There is from a safe zone. So the dog walks across the road in a safe zone next to you, like your child would holding your hand, things like that. But you're taking the dog for a walk. Not always exercise, like physical exercise, like going to the gym. Put on a treadmill, But what you're actually doing, you're allowing the dog to observe and look at the environment in which you're in. So it'll sniff along the trees because of other dogs being there. It'll look at little funny things. It'll smell the roses and so on and so forth. All that is mental stimulation at the same time of a little bit of exercise. And I find that mental stimulation is just so much more important than actual physical exercise. You don't have to take your dog for a 10K run every single day.
Sure.
Yeah, exactly. I know people that do. But if you go along and just give it mental exercises, and even just keeping the focus on the dog and asking it to look at you and asking it to do simple exercise like backwards or lay down and stand up and do a circle.
I'm going to stop you there. Talk to me, because we did have a conversation about this focus, and I want to understand it better, but I also want our listeners to understand. What do you mean by getting their focus?
So I'm finding that if you've got the dog's focus, in other words, the dog looks at you, I can actually start reading the dog. I can look at you and go, are you engaging with me? All right? If you're standing in, let's give you another scenario. I'm standing in a crowd of people, okay, or giving a lecture, for instance, which I've done in many, many countries. As I stand there and I look at the audience, it might be 10 people, it might be 100 people. And you will definitely guaranteed you'll get a few people that are there on their cell phones doing this. They're not engaging with me at all. And I will come along and go, right, everybody, can you stand up? And everybody stands up, and then all of a sudden there's this shocked look on their face, like, what's happening? Because they have not been engaging with me. Okay. It's the same thing with your dog. If your dog is looking over there, watching the butterfly, watching the squirrel, things like that, and you saying, sit. The dog's not going to sit because, first of all, its focus is somewhere else. It switches you off. So when I say focus, is that coming back up to you, making sure that you are listening to you. It's not all the time that the dog has to stare at you, because that's just a bit weird, okay? It's simply that is the dog turning and looking at you and acknowledging that you're there and that you are speaking and you're requesting a certain behavior. Okay.
So how do you get that? Do you tap them or you...
So easiest option if the dog is food related or food motivated is that you can come along and start off with literally putting the food, the scent of the food into the dog's nose and bringing that nose up to your eye.
And do you use the word like look?
Look, there's a number of different words that people use. Eye,
Eye.
look,
Eye. Okay.
focus, those kind of words. So you bring the dog up and it looks up at you. Yes, okay, fine. And then you give the treat. Then what you do is that you slow it down. So in other words, you might have the treat in this hand and you bring your hand up to your face like this and the dog looks, and then you give the treat from your other hand. Okay. We want to get rid of the treats as fast as possible. Okay. So then what we can, as I say, we've now got that look. Now we're working with a dog at the present moment. It's a stunning, stunning dog. But it's had a bit of issues. And it's seriously, in my opinion, a fearful issues of other dogs.
It's scared of other dogs.
It's scared of other dogs. So it's the size of it. It's a big dog.
What is it?
It's a German Shepherd.
Okay.
Stunning, stunning dog. But it would then lunge at the other dog. Now, of course, this thing's canines are like this size. They can do some serious, serious damage. But the owners have got eyes, and the dog is like starting to like shiver to go along and attack the other dog. She goes, eyes, yes.
Oh, wow.
Bam, everything's gone. The dog in front of it has just disappeared, according to the dog. So now we actually bring it doing something else. And that comes to your issue that with Piglet, is that you're asking her to sit, giving her something else to do as opposed to jump. Do you know what I mean? It's the same kind of concept. So it's a focus or eyes or whatever the word you want to use, but it brings the dog back to you. And once you've got that dog with you, you can most likely control it.
Or ask for a different behaviour.
Correct.
Oh, that's great.
If that makes, hopefully that makes sense.
No, that does make sense. So what do you do, and let me rephrase that. At what point do we call you, not as vets, but as owners? When is it that this is out of what I can manage at home and I need to now seek advice on my issue with my dog or cat or whatever? So at what point do we say this is out of our scope of being able to correct?
I think, and I think it's the individual opinion or need. If the dog is doing damage or starting to do damage to itself, and I say self-mutilation is a big problem, okay? Or to property, or to human life. Now, if it gets down to human life, I think you should have called me a long time ago, okay? But down to property, and when I'm saying down to property is that I've had a dog where it had free rein around the whole property, and it would eat the car in the evening. Oof. Now that's serious damage. Yeah. It would drag the creepy out the swimming pool and just destroy it, okay? Those little alarm systems, rip them off the wall. The dog was just out of its mind. You've waited a little bit long. You know what I mean? If you see this is not normal behavior, so therefore let's call us in as soon as possible. When it's starting to self-mutilate, and often a self-mutilation would start maybe a little bit of a lick, lick. The dog goes, it's just licking, it's cleaning itself. Look why it's licking. Is it licking in the same place? A dog that's cleaning itself will lick all over, not just its front paw. And now the dog is actually now starting to get hair loss. Hold on a minute, there's an issue. And a lot of that is a start of a behavioural problem. Although that owner will more than likely take it to the vet first, because hold on, now we're getting hair loss, it must be a veterinary problem.
Or it could be painful
Precisely. So yes, take it to the vet. No questions about that. But also, hopefully, your vet will then say, hold on, this could be a behavioural problem, and then we get called in as well. So it could be that small and that subtle, I'm going to say, when you're starting off. But it's best to catch it as early as possible. I get a lot of phone calls. Like, hey, just asking, is this an issue? Must I be concerned about it? What do you think I should do? And I'll advise over the phone and go, well, actually, just do this and this. Give me a call in a month's time if you still have a problem. And I don't get the call back, hoping that's been resolved.
Taking your advice.
Exactly, and it's resolved the problem. We don't always have to have the dog in front of us for the smaller start of behavioural problems. So we try and rectify them without us even seeing them. But all of a sudden, when somebody comes along and goes, oh, no, I've got dog fights, I've got serious destruction, I'm like, we need to see you soon, because that's going to escalate to human bites and stuff like that.
absolutely. Okay. And in terms of how would people contact you? You're based in KZN.
Yeah,
I know that you offer online consults if that's required. You've done work with Americans, and you work all over the world.
Yeah.
Are you able to advise, or how do people get hold of you?
Well, the best way is through telephone. If I answer my phone, I can speak to you. Or I'll tell you, I'll phone you back. A lot of people are using WhatsApps nowadays. I try not to use Facebook. I very seldom have time to look at my emails. But if you really, as I say, if you really want help, just give me a call. It's great to speak to people. So, but like somebody just phoned me just now. I'm like, send me a WhatsApp quickly, and I'll come back to you soon, because it's a little bit more to discuss than the very short period of time that I've got to talk to you. So then I'll call them back in the evening when I'm less busy. But I think understanding their problem over the phone, I can then very quickly advise of maybe what's the best course of action. So visits, you coming to me, or I see you at the vets, or whatever it is.
Or it's puppy training, or it's
simply
socialization,
exactly,
or it's
whatever,
adult training. Okay.
Whatever it is. And you're saying adult training. Some people ask me, they go, oh, my dog is 5 years old, it's too old to be trained. Actually, no, it's not. We can train old dogs new tricks. And it's actually, sometimes we have, they just come out of their shell. They go, oh, wow, there is a world out here. And it just makes a world of difference to that individual dog. So yes, any age, we can help.
That's great. And obviously having a well-adjusted dog is a major benefit for a whole family to not
Absolutely.
have. I don't think, until you have a problem dog, you appreciate how stressful it is, just the impact on everybody in the household. So to be able to resolve those things sooner rather than later is a benefit.
Absolutely. And I think what's also really important is that the whole family needs to be part of the solution around behavioural problems, where some people phone me up and they go, no, you can come around, I'm available. I said, but who else is in the family? Who else interacts with the dog? And it doesn't matter if you've got staff, if you've got, your spouse coming home late, whatever the story is, they all interact with that dog. And they all have an influence on the dog.
And they need to be part of the solution.
And I think it's one of the most important things is that it's a family thing. It's not just simply you and the dog. It is you, dog, all the family members along the line. They make a big difference to the dog. The dog's a family member.
Absolutely, and that's how you want them to remain, rather than them ending up having to be given up.
Yeah, absolutely.
We're going to take a break. Thank you for your attention. This podcast is sponsored by UltraPet, so I'm going to take a moment to read you their manifesto. For more than 25 years, we at UltraPet have made it our mission to take the ifs, buts, and maybes out of premium pet food. Because when we say scientifically formulated, it's a fact. When we say value, the numbers speak for themselves. When we say more meat, the proof is in the pudding. And when we say we care, our accident cover delivers. What sets us apart is not one thing, it's all the things combined. Because we understand that when it comes to your pets, you want certainty on all fronts. You want absolutes, the absolute best, given your means. Premium quality, but without the exorbitant cost. So, rest assured that any claim we make, we stand by. It's our commitment to your pets, our promise to you. And to prove it, we're willing to put our money where our mouth is. We've covered the fact that you can end up with behavioural issues or fear responses in pets, whether they're taken on as puppies or from a rescue situation, that there are means and ways for us to manage those things, but also just to be mindful and have a better awareness of the impact of our lifestyles and of the general sort of situations we come across, whether it's visiting the vet or dealing with a thunderstorm or fireworks, that there are ways for us to really manage a lot of those issues without getting to the point of it being too late. And
correct.
I think it's great that we can intervene, and I think, partnering together with your vet and your behaviourist can really result in a well-adjusted and happy family member. So that's great. Thank you so much.
There's just one other thing that we never really mentioned about, is that it's, you're talking about we can as owners make a world of difference, and it might not resolve everything, but it certainly does help, and that's sterilisation.
Very true.
It just takes away those urges that we have as owners have no control over, but we do have control. Is it unethical? Not at all. It actually helps the family by sterilising your dogs.
So explain why.
There's, a lot of hormones running around the dog, testosterones and estrogen and all that other kind of junk, is that these urges are uncontrollable for the dog as well.
So like a teenager.
Exactly,
it's
like
tough.
a teenager. It is really tough, but we can help them. And by removing that problem for the dog, all of a sudden the dog goes, well, actually, I'd rather put my focus or my energy onto the owner and be more,
sociable.
Exactly. As opposed to, as you say, teenagers that are, difficult.
Struggling,
exactly. And then a couple of other clients come along and go, right, whatever you say, I'm not drugging my dog.
Okay.
Now, we don't want to drug any dog. There's medication for things. It's not just drugs.
And you can start with over-the-counter.
We could start with over-the-counter stuff, which
we
is
spoke
really
about
simple.
pheromones in cats, and there are pheromones for dogs too.
Precisely, and it's, there's a product there where you just spray it on when you know that the dog is going to be coming into a bit of a stressful situation. That pheromone stuff for the cats works wonderfully well. It just chills out. Even to the point where, fluoxetine and stuff like that, it's a long-term medication, and we must understand that. But it's let me rephrase this, it's not the first thing we always go for. But owners think that, we don't want to drug our dog. It's no. If the dog needs it, we need to be open-minded to potentially give it. And it's not just my say-so, it's also the consulting vet say-so, and then potentially somebody else's also suggestion, because and we're working as a big group
as a team,
before we put that dog on any kind of medication that's long-term, for the benefit of the dog and the family.
And the benefit, obviously, of the medication is then it allows behavioural modification. So it just opens up that opportunity to better correct those behaviours.
And so we've had a lot of barriers on medication.
Why is that?
I think people just hear it and they think it's a negative. It's the opt out. So I'll just drug the dog. No. And the worst thing about it is that when we start putting dogs on medication, again, 6 weeks before anything really starts working, then, as you quite rightly said, we then start putting the modification behaviour training into that only at that point, as opposed to, well, can't you just quickly start it now? Well, the medication hasn't started. The dog can't cope. Allow the dog to start coping. Then we start training. Then we wean off the dog. But a lot of people think, well, it's a single tablet. It's like a Panado because I've got a headache. It's quick. It's not quick. But when the dog is at that level, it's better than euthanasia, because unfortunately, that's where we go into it. Absolutely. So I'd rather medicate the dog, help the dog over a longer period of time, and you will find a huge, big difference.
Absolutely. And like you say, even using those short-term over-counter medications in situations where you can anticipate, we speak about the vet visit, but the thunderstorms, the fireworks, the stressful trip to your aunt, whatever it may be, that can make a massive difference.
Or kenneling. You put in dogs in kennels, going for 3 days. Send medication for 3 days. It's only got a short lifespan, so half-life. So it's okay for the dog. It's not detrimental to the dog.
So owners shouldn't feel embarrassed or
not at all
concerned about asking for medication.
Yeah.
I think if we've got a bit of time, one of the things within a practice, and for professionals listening to this podcast, one of the things, obviously, as a vet and as a practice owner, who I feel very strongly about fear-free pets, is setting up the practice such that you can provide opportunities for the separation of dogs and cats, We mentioned before, obviously, the pheromones. We have pheromones pumping in our cat ward as well as our cat waiting room. If you can schedule your consults or ask for a consult where you know that there are not going to be dogs around if your dog is fearful of other dogs, or if you're bringing in a cat, to ask for a consult that is at a time when there aren't dogs if your cat's scared of dogs. We have cat scales in our consult rooms, which makes a big difference, not to go and put the cat then on the dog scale. But there are so many modifications that we've made, obviously separate kenneling and when we in different handling areas of our patients, in order just to try and minimize that stress and to try and reduce the fear. We want our practice to be a positive experience as much as possible. Obviously when we're dealing with sick or injured pets, you can't get away from having to use the vets. But we certainly want that, so that when they do come back in for their annual vaccination, it's a good experience.
Correct.
And we work very hard to try and do that. So if owners do communicate well with us and say, my dog has this particular need, we will always try and meet those needs. I think it's really important we try and work very closely with owners to try and make it a good experience for both them and their pets.
I think the thing you also mentioned now is on the cat side of it is, I've seen at your practice and also a lot of rabies clinics that I've done, people rock up with their cat without a basket, without a carrier.
Yeah.
And it just helps the cat to be feeling more secure. So put your cat in a basket or a carrier. And if you don't have one, well, that's fine. The vets will. And I think it's so important that a lot of people are too embarrassed to ask. Sorry guys, my cat's in the car. Do you guys have a carrier? Of course we do. Please take it out, put your cat in the carrier, and know everything, and it's safer for the cat.
I mean, how many cats? Sorry, just so the audience understand, we've just done a rabies drive where people were turning up with their dogs and cats in the car, and we were vaccinating them from outside of the practice. And how many cats did we see just thrown into the car, loose?
I think the best I've had is like 5 or 7 cats in a car, loose. Now I have to climb in the car, close all the windows, and then scurry around trying to get the cats from under the seats and things like that.
It's high risk.
It is high risk. High risk of losing a cat when you get in and out the car. Yeah. High risk of also the stress factors when you put your hand in there, because the cats now are so fearful that they're going to scratch or bite and things like that, and it's just not fair on the cat. So let's be open and go, hold on a minute, we're not going to bring in cats without carriers
or dogs without leads.
Sorry, I'm blaming that. My dog always comes in your practice without a lead. But no, you're right. It's just out of that, it's safer for the animal. And I think we must look at it from that point of view. A darker environment for the cat is actually better. And we're working within your consult room as well. That's been put in place on how to actually eliminate certain fearful interactions. But it's what the owners can do. And also what the receptionist of the vet practice can also advise the owners what to do when they walk in. So the cat is actually already calming down before the vet sees it. It just helps. Every single of those steps
makes
can help.
A big impact to our physical examination, both
Correct.
from the parameters, temperature, heart rate, respiratory rate, but as well as sort of just generally handling them and not having to restrain them as sort of roughly as we want to avoid that.
Yeah. So. Just because they're small animals doesn't mean that we have to, or we can't just put a pair of gloves on and wrap it in a towel. If you don't have to, don't.
No, absolutely.
Yeah.
So you have a really upset dog or cat, and we can separate them into 2 separate things if you want to. What do we do in that situation? So they've come in, they've got themselves so wound up. How do we manage that situation to not end up either being bitten or reinforcing that fearful response?
If we can, and I know your practice does this, if it's, let's say it's a dog, and it's a big enough dog just to be able to walk, and it starts freaking out, for instance, I would immediately take it outside, like get it out of that situation. Okay. Are we, we're taking the pressure off and calming the dog down, then we can start again if we have to. I'm not saying that the vet has to come outside and walk around the car park with
Although
it.
they often do, don't they?
Do. But it's like just taking that dog out of that pressure zone, and then rather introduce it slower. And the owners must also understand that this consult, although your vet might only see it for 15 minutes, but the consult might actually last for 45 minutes. Because of the pre and post exercises that we can do, so we can prevent the same circumstances happening again the next visit we have, So that's number one. From a cat point of view, I would rather put it in a calmer, quieter area of the practice and leave it alone. Cover it. So it's calmer, quieter. Covering it too much is not really going to help with the pheromones that you're pumping around there. But it's important that we actually just take the pressure off the dog or the cat. And by taking the pressure off the animal, it goes, oh, okay, well, there's nothing else happening. And then we slowly put the pressure back on. And I say the pressure, handling is pressure for the dog sometimes, okay? Using any form of equipment, so a lead, a muzzle, that kind of stuff, is pressure for the dog. So if we can just slowly introduce it to it, if we can, then I think that's the answer to get that potential danger down. And I'm talking potential danger for the dog, for your owners, for your vets, for the receptionists, for absolutely everybody.
What I've found, particularly in, obviously you want to get to the point of not having the issue, but what I've found, often people don't touch their dog's paws or ears or muzzle or look inside their mouth.
Yes.
And one of the hopefully best sort of bits of advice I give a puppy owner when they come in for their first vaccination is, just take the time to touch their tail.
Correct.
Have a feel under their tummies.
Yes.
Look inside their ears occasionally, because if they don't have that kind of interaction, suddenly when they get an ear infection, they're going to be horrified when someone tries to look inside their ear, or they're going to be like, why are you touching my tail? We need to take a temperature. So it's actually also that conditioning, which we talk about all the time.
Absolutely. And it's one of those important things that we do at puppy lessons, that we actually place the dog on the table at puppy classes and go, right, now examine your own dog. And you can go along and pick it up. And also, nail clipping. Nail clipping is a huge issue.
Oh, it's a massive issue.
And
they're scared.
They're scared. I mean, the sound of them, you bring in, and the way you hold it, and some people over squeeze the paw. It's just not a pleasant experience for the little thing. So, and I agree that some owners should never cut their dog's toenails. They should come to the vet. But if they just desensitize the dog to those experiences, it just makes the dog's experience and the vet's experience so much better.
Yeah, we're very grateful for that.
So I think you definitely need to really, as I say, promote it, and it doesn't matter who's promoting it. The receptionists even, they can go along. Now don't forget, groom your dog more frequently, or lift its paws up, or pod and poke it. Pretend you're a vet, especially with little children, because they actually enjoy it to the point where they're thinking that they're doing something great, and they're doing something amazing by just simply desensitizing that dog.
No, that's great.
Yeah.
Really nice.
Yeah.
Very good.
Cool.
So we can contact you. We'll leave your contact details so that if anybody needs to contact you for behavioural consults, that they can do so.
Absolutely.
I think it's been fairly informative. Obviously, we're very open to questions. I'm very happy to advise on any burning questions we will try and answer. People can contact us.
Yeah.
But I'm sure we'll be engaging in more behavioural discussion, and we can touch on some of those subjects.
And if audience comes along with questions and stuff like this, it might be an option of coming along and answering them from our side, and it'll be good. And thank you. Yeah, it's been great.
That's been great. We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behaviour? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, We want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drcarra@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.